Action to anti-inflammatory drugs.
Well, tomorrow is Go Red for Women Day, a day to educate women about heart disease and to empower them to take charge of their health. Liz Sharman is a local teacher who received a diagnosis she never expected. And we're also joined today by Providence doctor James Beckerman. Nice to have you both here today. Liz, I first want to start with you. You began fainting as a child, and you went many years until you were diagnosed with a heart condition. Tell folks what that was and what this was like for you all these years.
Well, it was difficult because I had a lot of doctors kind of dismiss my condition because it seems like kids can't have heart problems.
Right.
So it was like, oh, you're not eating enough, or, you're too high strung or something like that, as reasons why I was passing out after exercise and things like that. So it wasn't until I was about 23 years old and had a hypoxic seizure at home that they really started paying attention to what might be going on.
And you seemed young and healthy. You wouldn't think that you would have a heart problem. How has this changed your life? I know that you make healthier choices in your life now, but how else has it changed things for you?
There's some limitations. I have to be careful when I exercise. I can't do any competitive sports or anything like that. No swimming, no haunted houses. I'm not supposed to be startled, which I think is pretty funny.
It's interesting to me, Dr. Beckerman, I'll bring you in now, is I think there are a lot of people watching right now, especially young women, who think, oh, I don't need to worry about heart disease. This isn't going to affect me. That's a lot of women do that, don't they?
It's very true. The truth is that when you look at the statistics, 1 in 31 women will die of breast cancer this year, but 1 in 3 will die of heart disease.
Amazing. And not just from an unhealthy lifestyle, but perhaps seemingly healthy, like Liz is.
That's right. And I think the message to take is that if you don't think about it, you're not going to diagnose it.
Right.
And also, I think that when a young person has symptoms like that, passing out while playing sports, we have to take it seriously.
And there are so many other symptoms, but why this push, Go Red for Women? Why this push to make so many people more aware that women are at such a high risk?
I think because only 1 in 6 women recognizes that heart disease is her greatest risk.
Right.
And given that 90% of women have at least one risk factor for heart disease, there's a great opportunity for prevention.
Tell us about some of those risk factors, if you will.
Sure. Well, we try to get people to know their 5, which are these 5 numbers that are very helpful to know. Blood pressure, fasting blood sugar, knowing your triglycerides, HDL cholesterol, and LDL cholesterol. Easy to find out. And if you learn about them, you can do something to reduce your risk. Diet, exercise, sometimes medications can help too.
And symptoms can manifest themselves that you might think there's something else wrong with you. Perhaps if you get lightheaded or you have a chest pain, you might think it's indigestion.
Yeah.
But these are really things to pay attention to, right?
They are. And you think about the person, clutching their chest with chest pain, but sometimes it can be something as simple as not sleeping well or having new onset fatigue or dizziness. And so, like I said before, if you don't think about heart disease, you won't diagnose it.
Right.
So while you don't want to cry wolf, you also want to make sure that you have awareness.
Better safe than sorry.
Absolutely.
Liz, as I mentioned, you are one of those people that women will look at and say, oh, there's no way that anything could be wrong with her. What do you want to tell women at home right now who may be thinking, oh gosh, I think I'm okay?
I think it's really important to understand the risk factors and really pay attention to your body and advocate for yourself.
Yeah.
One of the things that really has helped me is making sure, hey, I know something is wrong. I keep going back until I figure out what it is. And that's a very important piece, especially not just with women, but with young children too. So that, really advocating for yourself and paying attention to your body.
Before we wrap up, you want to say hi to somebody out in the audience there?
West Orient Middle School, you rock. My students out there, they're very excited that I was here today, so I told them I'd give them a shout out.
We're glad you're here and that you're taking care of your health and that you're doing well. And Dr. Beckerman, thank you for your insight. And by the way, you can learn a lot more from Dr. Beckerman about improving your own health. He's offering a free talk at the Oregon Zoo February 8th. And if you'd like the details, go to Providence Health page on KPTV.com. We'll get you everything you need to know.